Hello, my name is Katie Weber with the Indiana Complex Care Coordination Collaborative at Indiana University School of Medicine. I am here to offer ways to accommodate an exam of the male genitalia for individuals who need special assistance. Individuals with intellectual or developmental disability, often called IDD, may experience anxiety at the doctor related to unfamiliarity with the situation or a past experience of difficult medical encounters. Lack of cooperation may be related to anxiety and can create challenges in examining some patients. Many individuals are taught that the pelvic area is a private, bad touch part of the body, which can create additional challenges in cooperation. Persons with IDD may have experienced sexual trauma in their past. The first step is to consider how best to adapt your communication to fit the person. Ask about abilities in both receptive and expressive language skills. Acknowledge accompanying persons and verify their roles. Remember that the person may not be a trusted helper who the patient wants with them in the exam room for a private history or exam. Key points in communication are: speak directly to the individual. Specifically, seek consent or assent when performing an exam or procedure. Explain and demonstrate. Information is easier to understand when large ideas are broken into small parts. Visual tools can be helpful to aid in understanding. Speak and move slowly. Processing time is often slower for individuals with IDD. You may need to allow 15 to 20 seconds after asking a question to get a response. Use simple and comforting language. Use repetition and recap key points at the end of conversation. Praise cooperation. And take 5 to 10 second breaks when needed. One should build a good and comfortable rapport with a patient before broaching the topic of a genital exam. Once this has been established, then it is reasonable to recommend an exam for preventive or diagnostic purposes. Begin with an explanation of the planned exam. Seek assent or consent. If there is hesitancy, encourage the help of a trusted accompanying person. It may be helpful to have a conversation about the differences between good touch, bad touch, and necessary touch. Good touch makes you feel happy, safe, or comfortable. Bad touch makes you feel forced, hurt, or afraid. Necessary touch can describe touch that might not feel comfortable, but you still decide to do for good health. You may want to help the patient seek the input of a trusted support person. Once you have obtained consent or assent, ask about options to best distract or incentivize the person to ease the exam. Some men may prefer to watch a video or engage in conversation for distraction. At the time of the exam, consider whether your patient can lower his pants or change into a gown without assistance. If you have your patient change, indicate proper gown placement. If there is not a support person who the patient wants to be present, offer a chaperone to help with examining a private part of the body. Consider best positioning, whether laying or standing. Standing may be the easiest, but also puts you, as the examiner, in a vulnerable position if your patient has tendencies toward hitting others when uncomfortable or upset. Approach the exam gently and slowly. Tell your patient in simple language what you are planning to do before actually touching him. Offer relaxation. Offer 5 to 10 second breaks and remind of relaxation techniques like deep breathing or distraction. Reassure that the exam does not take long. Start by inspecting the inguinal region and the genitalia. Then tell him you are going to touch his penis and testicles to check for anything wrong. Describe what you see and palpate. If your patient has questions about his genitalia, answer in simple language as you examine. If it is indicated, then move to the rectal exam. Direct your patient to laying on his side or standing with his torso bent over the exam table, assisting if needed. Describe your next step before acting, telling him that you are opening his butt cheeks to look at his butthole and then placing a finger at the butthole before inserting. Encourage him to bear down to open the anal sphincter before you insert your finger for the exam. When you have completed, offer a tissue or a wipe so he can clean himself. If at any point your patient requests to end the exam, stop immediately and praise him for cooperating to the best of his ability. Restraint, coercion, or forcing parts of the exam should be avoided. If there is an emergency reason for the exam, sedation may become necessary. Once you have completed the exam, allow your patient to get back into a comfortable position. Discuss any findings and recommendations, answer any questions he might have, and give him specific direction for follow-up or next steps. Thank you for watching. To assist your patients in preparing for a male genital exam, you can refer him to your partner video at forourhealth.org.